welcome to Health Issues. I'm your host, Chris Sylvain. Thoroughly excited about today for a lot of reasons. We'll talk more about some of the implications. We're talking about infant mortality, but we have a great guest. She was last on in 2009, groundbreaking show, and should have had on more, but we will. Dr. Joia Crear-Perry, welcome, Doctor. How are you?
Thank you. I'm honored to be here yet again. It's always a pleasure.
All right. Well, we're honored to have you, and we'll talk more. All right. Let's cut to the chase. I'm gonna start off with a story.
Okay.
Okay. And my daughter won't mind. Mm-hmm. If not, we'll talk. Mm-hmm. But yesterday morning, Sunday morning, we're taping on the 16th or 17th anyway. So Sunday morning, October, I get a call, 6:15, 6:30 in the morning. Daughter says, "Daddy, I'm in labor." I said, I said, "You a little early." She said, "Yeah, 22 weeks."
Wow.
I said, "Okay." I said, "I've seen, great things can happen.
Right.
I'll be over there in a minute."
Okay.
Sure enough, well, it didn't happen.
Okay.
Okay, but she's fine. Husband's fine. She's fine moving forward. I had another daughter, 23 weeks, and that was some years ago.
Right.
And so the issue hits home.
It does.
36-year-old African American female. Other daughter, when she first heard, I think she was like 20. 23, 24, African American female, relatively healthy, right, doing well,
right,
definitely not hungry. I mean,
exactly.
And I'm saying, man, we're about to talk about this.
We are
tomorrow morning. So let's get it started.
Yes. Well, thank you so much for sharing that with me, actually, because I know sometimes it's hard in the middle of something to take a breath and be able to share your story and your testimony. So I appreciate you for sharing that. Part of the reason that I do this work, so I'm an OBGYN by training, but I also had a baby at 22 weeks when I was 25 years old. So my son, who's now 20, weighed 445 grams. And so part of this work, and part of what I understood then and still understand now, is that we cannot buy or educate our way out of having babies early as Black women. That our bodies are stressed, and the stress of that when you are pregnant is even compounded even more. So we're kind of built to survive as a race, as a human being. You're built to take care of yourself. So when you're pregnant and you have another body inside of you, the stressors that come along with life build up on top of that. And sometimes your body says, "You are doing too much right now, Black woman. You need to relax." And so your body wants to live, and then we have our babies really early. And that's a really simplified way of saying that the stress of being Black in America, one of the things that happens is we have babies too early and they die too fast.
They have babies too early and they die too fast. It's cut and dry, just straight, no chaser. Yeah. All right, you spoke at the UN.
I did. It was so, I still can't even imagine that I got invited. So I'm a part of a group, so the name of my organization is the National Birth Equity Collaborative. We're about 1.5 years old. We have some funding from Kellogg to work specifically on Black infant and maternal mortality. And so it's great to have this kind of base that's not governmentally funded, because Kellogg is a funder that's really explicitly saying, racism makes us sick, right? So having racism in America is something that we're going to have to get rid of in order for us to live and be healthy and to live to our full potential. So in that work, the UN sanctioned the U.S. in 2012 because we're the only industrialized nation where maternal mortality, women dying within a year of having a baby, is going up. Everywhere else in the world it's going down, especially in industrialized countries. But here we are, the U.S., that spends more per capita than any other country on health care, and our rates of women dying in childbirth are going up, and it's specifically Black women, and specifically Black women in the South. And so that's not, so it's framed a lot of times that we're more obese, or we wait so long. We're not 4 times more obese.
Right.
You can give us a lot of things, but that's not what we're not. And so, this personal responsibility language that we've been using in the U.S. when it comes to health care for generations it's just making us sicker. It's making us more ill. So we have to get out of this narrative that if only you people would behave differently, you would do better. Like the only person that helps or hurts is us. And so the UN sanctioned the U.S. and said it's a problem. They also sanctioned the U.S. around mass incarceration. They sanctioned the U.S. around police violence. So it's a list of things. And most of these things are things that impact black people. So it's transformative to be in Geneva. You know, I've testified in front of city council. I've testified in front of state. I've even testified in front of Congress. For me, though, being at the UN and being in Geneva was life-changing for me. Because there, you really understand that we're in a global context, and that although we spend so much money on health care, we don't develop individuals in this country. And so when we don't believe that so the human rights framework says every person has the ability to live to their fullest potential. So that means that you have to do what it takes to ensure that every human being can live to their fullest potential. So if someone is having babies at if a group of people is having babies at 22, 23 weeks, what are you doing? What is your obligation as a society to work on that, to prove that?
Okay, let's, I mean, good stuff, solid. Let's grab a hold of some key points. I want to grab a hold to the African-American women in the South, black women in the South. Talk about that a little bit.
Well, so we know that black women in the South are explicitly, they're poor, right? So they tend to have less access to education, they work daily, hourly jobs in general. They don't have health insurance in general. You think about the Affordable Care Act. The South, Louisiana is one of the few states that just recently in July did Medicaid expansion. Before that, we had high uninsured. So you can be poor and uninsured in the South, which is, if you're in another country, they can't imagine that the U.S. would have a group of people who don't have insurance, right? So when you step outside of our frame and look from another place, if you're in Uganda and you're trying to rebuild a country and you're aiming to be the U.S. because it's so magical, to hear someone from the U.S. say, well, we have people in the South and in the U.S. who have rates almost as bad as yours because they don't have insurance, they don't have access. And then when they get to the healthcare facilities, they're treated and seen as different, right? So that's the moment that's hard to tease out for people. Like in New York City, black women have morbidity, which means that they can almost die in childbirth at 3-4 times the rate of white women. But mortality is at 12 times the rate, okay? So that's huge. You're in New York City. There's healthcare, you can fall on, there's hospitals everywhere, clinics everywhere, and so to have 12 times the rate of women dying that's not about access. It's not because they can't get to a hospital. But when they have a heart attack, do you believe that it's a heart attack, or do you think it's something else? And you send them home and they die, right? Because you're not treating them for their hemorrhage the same way or their chest pain the same way. So we really have to pull back onto when our implicit bias, right? That's the new language around that. Like, what do people think when they see someone, a black woman in the South, and she comes in and she's hemorrhaging? How do you treat her? What do you see when you see her? And then what measures are you taking to make sure that she's okay? And we can't just say, well, she shouldn't be so obese, she shouldn't have hypertension, she shouldn't have diabetes. So, a lot of times in the meetings we say, well, we'll take that, we have a lot of things we could do better as black folks. Agreed. But what's your part in this society? What's your part, hospital system? What's your part? What could you do differently?
Okay. Infant mortality then
yes.
Appears to be the barometer that we need to really kind of get an idea of how this particular black society is doing. Yeah,
we like to call it the canary in the coal mine. So I had to look up, people use that phrase, I was like, what does that specifically mean? Yeah, exactly. So coal miners would send a canary in to see, and they would keep it with them in a cage to see if it was too toxic of an environment for them to live. And if the canary would die, it was time for the coal miners to go down, right?
Okay.
So if our babies are dying, it's the environment that's killing them, right? They're just babies. They haven't done it. You can't say that the babies are too obese, right? The babies don't have this personal responsibility, right? They just want to be born and be loved and be cared for. Right. And so the environment within which they are coming to is too toxic for them to be able to survive. It's easy for physicians to understand this. If you have lupus, or there's a whole movie, Steel Magnolias, right, about a person who had diabetes. When your body is ill, you are more likely to have the baby early. So people really clinically understand that. If you're in kidney failure, like all these things, you have an increased risk of prematurity. Being black in America is an increased risk for prematurity, right? And so we do all these things to try to, instead of looking for a gene or a pill, we really need to do things to alleviate the stressors that make our bodies have this constant kind of catecholamine release, or a constant, you can almost, I describe it as you can feel like a humming, like your nervousness, you're on edge about if you're going to have a job or not, if you're going to be able to pay your mortgage or not, if there's someone's going to come and, police violence, like all these are realities that make you massacre, all of that. Right. So if you're living with that and then trying to have a healthy baby at the same time, I mean, that is a difficult task at best. Okay.
Now, but the studies have shown that, again, if we're equal to Uganda, and they have, same race of people,
right?
Okay, we're a little bit more mixed, but still,
right.
maybe not, but still.
Right.
But the thing of it is, though, is that it can't be genetics.
No, and so that's the real moment that when I work with organizations, our organization works with the March of Dimes and with these national huge organizations that are working on this. Looking for this genetic basis. We've done the whole genome now. Really, what even makes us be black, right? What is the gene thing that says I'm as black as Tiger Woods? Like, this is all, it's a sociological construct, okay? Right. And so then all the things that are impacting us to make these inequities are constructed as well. And we've had 400 years of these constructs. So it's not gonna go away by just saying we get the right to vote, right? It's not going to go. You're not going to be able to alleviate it by just saying, we're going to have free healthcare. Even like having access to a clinic is not going to get rid of all these injustices that are going on around us. So,
all right, good stuff. Okay, now we can go and flip it around. All right, are you guys throwing out the information, or are y'all looking at solutions?
So right now, the first thing we're funded to do is actually gather information. Okay. So the way we frame infant mortality currently is around medical illnesses. So prematurity, SIDS, which is sudden infant death syndrome, and congenital malformations. Those are the three leading causes of infant mortality. The problem with framing it that way is then you keep looking for medical solutions. So you say things like, for prematurity, we need to find more injections, or find progesterone. For safe sleep, we need to come up with put your baby on the back alone in its own crib, So we come up with these very medicalized things. When you frame it in a more understanding that there are social determinants of health inequities, that in order for us to have this disparity, that we have to get rid of some of the policies that create these inequities, then it's easier than to actually get rid of the inequity, right? So we have interviewed women in 7 cities across the U.S., black women who've had an infant death. Right now we're listening to their actual stories. Most of the times you see reports and data and no one's actually talked to anybody impacted, right? So you don't have a sense, you just can pull some data and say, this is how it is. For example, we spend a lot of time talking about teen pregnancy, which is important for a lot of reasons. Not necessarily the reason around infant mortality though, for this reason. You have the same rate of infant mortality for someone 15 to 19 as you do for someone 40 to 50. Right. But we don't tell 40 to 50-year-olds to stop getting pregnant. Right. Okay.
Yeah, we're trying to get them to get pregnant.
Exactly. And so we're not honest enough with the data to say, also 40-year-old, 42-year-old, when you get pregnant, you have a high risk of having an infant death. What are we doing to support that person? What are we also doing with a 16-year-old? So going back to listening to the stories. So we learned so much, like, women have no place to grieve. So in the U.S., especially in Louisiana, we obligate women to bury their babies. If you lose a baby, if your baby dies at 22 weeks, we say you have to have a funeral. But do we say, and we also provide grievance counseling for you, therapy sessions for you? None of that exists.
If I could stop right there, wouldn't Nut said that anyway? Why are we doing this ludicrous foolishness where people actually even present to say, well, if you don't have no money, you can let the coroner take them. Right. But if you got cash, right, you can go to the funeral home right in the middle of this. How did that come out? My assumption is the Right to Life group decided that they wanted to make a point. Yes. So they subject thousands of women to this torture.
Exactly.
At a horrible time.
It is. And no one has life insurance on their pregnancy, right? And so, it creates a burden, a burden that we have not even come up with a process to fix.
And why they come up with 20 weeks? Right. What happened to 19 and a half weeks?
Exactly.
It's a baby at conception, depending upon how you want to look at it. So all of a sudden now we have a whole new set of laws.
We do.
Just to satisfy And the same folk were creating the problem in the first place.
Exactly, right? So if we could have some sex ed, right? So it becomes a cyclical. So, going back to even the human rights, the human rights framework, we would never have any of these rules because it doesn't make sense for the people who are being impacted to obligate them to have a burial and then not even provide for them a resource to do that, and then not provide for them an opportunity for grieving, and like all these other things that if you really cared about the person, you would start with what does the person need if they lost a baby at 23 weeks.
I think we need to go through this because currently some legislators, I hope a lot of them look, so I hope they would look. Currently the state of Louisiana says at 20 weeks, if a baby's stillborn or whatever baby died, you have to have a funeral at 20 weeks. I mean, so they got to do a birth certificate. They had one lady tell me, she had gotten over it, then she had the birth certificate come in the mail, then the death certificate comes in the mail, but at 19 and a half weeks, nothing happens. And this is purely, this is garbage, man. This is nuts. It doesn't even make good common sense. So legislators, please change that yesterday.
Yeah, it's just, the burden is on whom? But the point, so we make these rules and we burden the people who are being impacted. And, and I hope that wasn't their point. Because if someone loses a baby, you want to add more burden to them? Like that was the goal?
I don't think they care.
Yeah. Oh.
I don't think they care. Because to say they don't know is dangerous. I would rather them say they don't care. But to say they don't know, you know what I mean? To me, that's too dangerous to play with a bill like that and not looking at the implications on how it would happen. But still, let's move on. But the thing of it is, though, is that mass incarceration came up at the same time. Any discussion on the relationship between the two?
Yeah, so for a lot of people, not having a support system. So we'll say things like one of the indicators for infant mortality is unmarried household, right? One of the, they'll say a risk factor is single female head of household. But yet, you've incarcerated all these brothers, and even when they get out, their ability to actually make an income is limited, because now they have this record, and so you created a system that is untenable for us to have any kind of stability in the first place. And so there's no responsibility, there's no culpability on them. Well, what are we doing to decrease the number of folks that are incarcerated, and how do we then also help people when they get out to find meaningful work? To say just magically because you get married that your outcomes are going to get better is a falsity. In 1970, Nixon, on his war on poverty, he came up with family planning. And so his thing was to put family planning clinics in black and brown neighborhoods. If at that same year, instead of the war on poverty being family planning, it had been free college, right? Think of where we would be as a nation. Think of how much different our outcomes would be, because trying to legislate and orchestrate middle-class value systems without giving people middle-class information and apparatus, all you end up doing is causing things like mass incarceration and prematurity, because you're putting rules on people who you've given no access to and no education to, and then you're saying, but you should just be able to do it.
Yeah, population control.
It is. Really, yes. It was called the Office of Population Affairs.
Yeah, I call it the Office of Genocide.
So you make up an Office of Population Affairs to, and so when you say these things, a lot of people don't believe you. But it's the truth. It is how we built this country. We built this country from the beginning, believing that people of color were lesser than, or not even human. And so it took so long for us to even get human status. And now trying to undo some of these rules that are in place, either laws that are written or unwritten, that makes us not be equal in how we're treated, causes us to have all these outcomes. Okay,
let's do a quick rehash. So the UN sanctioned the United States based upon, let's use these two areas. I know there's a lot of them, but one was the infant mortality rate, and the other one was
mortality.
Was that?
Maternal mortality.
Maternal mortality. All right, and mass incarceration. Those were two. So you were part of the group speaking about maternal mortality. This great developed country with billions of dollars and #1 in the world and the world's policeman.
And so on the panel with me, so the moderator of the panel was the ambassador from Colombia. And then the other country represented was the health minister from Uganda. So that's why I bring up Uganda and myself. And so in Uganda, they have, a lot of infrastructure that they need to rebuild. And so one of the choices, the UN has buckets of money for human rights. They also have buckets of money for development. So development is, building things and doing. So there's a tension around, is maternal mortality a human rights issue or is it a development issue? So I even learned in being in that space, trying to navigate kind of the politics of everything has politics. City government has politics. State government has politics. Guess what else? The UN has politics. Right. So imagine that if you have this kind of tension between, is this a development issue or is this a human rights issue? And that's an important thing to try to parse out. And so, it kind of already been warned that there was a little bit of tension internally among the workers around which place it should lie. And so the health minister in Uganda brought up a story that he had gotten free beds from China. And, he was very nice, And he said, we appreciated the free beds, but they were too small for our patients. And so when they were labor, they broke them all. And so now we have to get more beds. Okay. So when you don't use a human rights framework, you don't look at the actual person that you are getting these things for, right? Wow. And so you get things like beds that don't fit. If China wanted to do human rights development in Uganda, they would actually see the size and the weight of the women and make beds that fit the size and the weight of the women in Uganda.
Fair enough. Yeah. Human rights. So Black Lives Matter in Uganda.
Yes, exactly. And so this is really this moment of piecing all. We really understand that in order for us to have Black Lives Matter be fully actuated, effective, that we have to really be embedded in this human rights framework. This idea that we have the ability to live to our full potential in every part of our life. Like I want our children and our grandchildren to be able to live to their full potential. Right. And so what barriers have we put in place as a country that stops that?
Okay, not to digress, so to speak, but so looking at it internationally from that standpoint, human rights standpoint, the phrase, I've never liked the phrase Black Lives Matter, you know what I mean? Not that it's not bad or whatever. I've always felt that using black power was a more honest way to speak it, but we want black power. You know what I mean? Begging somebody to make our lives matter to me is a no-win situation. You know what I mean? I like Black Lives Matter. I don't care if you're like black, doesn't matter. You know what I mean? It doesn't leave us in, but black power says, no, we just want more power. Pure and simple. We need that to survive, and so therefore, by any means necessary, we need to make that happen. How do you see that Black Lives Matter context concerning maternal mortality or infant mortality in an international context? Your thoughts on that?
So to your point, it's hard a lot of times because this is a power conversation. It's an economic power conversation. It's a political power conversation. Like, how do we have room for everyone at the table? It's like the table has been set, and we've been over here at the kiddie table for 400 years, right? And so now they're like, oh, it's a lot of y'all now. The kiddie table doesn't fit. Where do we have y'all to now fit into our table that we've already set? So that means changing what we're going to serve. I don't like kale, I want collards. That means a lot of things have to change around how we do our healthcare system, how we do our policing system, and they're fundamental. Like, if we were in charge, and this is what people understand, if black folks had more power, we wouldn't do a lot of the things that are done the same way. However, so that's scary for people who have power, because if you have had how's the phrase go? If you have privilege, then equality feels like oppression, right? Okay, so we've not had privilege. So I use my physician privilege to get me into rooms. So that's how I can go and meet with. If I put doctor on things, people have me to come, and then I bring my advocacy and my other rabble-rousers with me, and we and sometimes people don't like that, but I'm going to still be me. So this is how this is going to go. It is what it is. So using framings and words that people can hear. Okay, so that's what I've been working on. That's what our organization's been working on. So sometimes people can't really hear you when you say black power. True. It ends the conversation. True. Okay. That's right. And so yes, it does feel more. It is what we want. We need more power. We're not going to be able to get any kind of stability in infant mortality unless you give us more power, right? Because how we fundamentally do the work in state, local, national governments would be different. We would hold things accountable. Like right now, what we're asking for on a federal level is for them to count the number of maternal deaths the same way in every state. That seems like a simple ask. We have been asking for that legislation for the last 3 years. It cannot get through Congress. It's just called the Maternal Mortality Accountability Act, and it says the CDC has a mechanism for you to count. We would like all the states to utilize this mechanism.
So we have decent numbers.
Right.
It may be worse.
Right. So So we know, you and I, we know that part of the reason they don't want to account because they don't want you to really know how bad it is. It's not going to be better. Can we agree that it's not going to be better? It's going to, at the minimum, be the same and probably be worse.
Right.
Okay. And so, you know, that accountability is one of the things we need, and we need overarching accountability. And so what I loved about the UN experience is knowing that there is an international body that is looking at us. There are folks outside of the U.S. who say, no, y'all not really treating people of color the way they should be treated, and you need to do better. And so we can't brag and say we're the policemen of the world if we're being held accountable to this standard of, no, but are you counting even your maternal mortality? So in Uganda, they count maternal mortalities, but they don't count infant mortalities.
Okay.
But you know why? They have 6 kids per mom. So they need all the mamas they can get. And so they are really nervous when a mom dies because who's going to take care of these 6 kids?
Right.
But, you know, in the U.S., we keep up with infant deaths.
Good. Now, all right, real quick now, just to sum it up. Recognize in the current political climate, the apolitical party they're very vocal about privilege and racism and so forth, the way they want to frame it and define it, which is genocide for African Americans.
Yes.
Pure and simple. Okay, so we recognize that making America go back to where it was literally wipes us out.
Yes.
We no longer become, not only not have power, we don't have nothing.
Right.
All right, so it's not,
they might be shipping us back.
Yeah. So
don't you like Kenya?
Uganda, you say you like Uganda, you know. How about it? You know, we got a ship going right. All right, so, I mean, but it's very open and very honest.
Right.
My concern, though, is that are we being honest about the threat to our very existence, particularly when we're looking at solutions?
Right.
Because as long as we have, whether it's 40 or 50% of the nation that is either willing to be warm to it or advocates of this genocide, that leaves us with no choice. In other words, we can't play games with this thing.
We cannot. You know, and so racism in the U.S. is not new, clearly. And so, but this is almost like this moment of their last ability to have a lot of power, okay? So that's why I think it feels so desperate. Like, if you have had presidents who have done things like create mass incarceration or done things like create, you know, our founders who owned slaves, like all these things, this is kind of the last iteration of that, hopefully, right? So that, yes, we still have 40% of the nation who wants to hold on to this power, 40% of people who they poll who wants to hold on to this power because it feels like oppression to have equality. I get it. So you are accustomed to being in power, whatever that looks like. So,
all right. Part 1.
Right.
Dr. Joia Crear-Perry, look, fight as hard as you can, but listen. Believe me, listen, people. Thank you so much.